Hey there, everybody. I'm Dr. Josh Satterlee.
And I'm Dr. Rebecca.
Hey, Dr. Rebecca. So let's talk communication here. I know that you and I were looking at some recent research, or I guess it's kind of recent, but it was interesting when we talk about communication. I think one of the things that we may do when we're busy and whatnot, we just give a bunch of advice and ask the person, all right, you understand? And then we leave the room, right? And the research we were kind of talking about was to overcome that or address that to make sure communication was actually happening, which is, the biggest part of communication is, did you actually communicate? What are you looking at?
We were looking at something from 2019. It's actually an article called The Use and Effectiveness of the Teachback Method in Patient Education and Health Outcomes. This was done by Yen and Leisure, and they were looking at communication that happens at the very end. So what happens when a patient is discharged, just like what you said? We kind of say our blurb as a provider, we say, see you later, and then what happens? And they actually found that the vast majority of patients leaving the hospital after being discharged had no idea what next steps were. They had no idea why they were taking a certain medication. They were just completely clueless. So they wanted to see if there was a way to fight that. And hence the teachback method kind of became a thing.
I mean, think about the environment, right? The context of what we're talking about. You have somebody whose life may have just changed. They got hospitalized for a disease something very common, diabetes or heart condition where, hey, for the rest of your life, you're going to have to deal with this. And at that time, oh, by the way, you also have to take care of your billing and payment. And oh, by the way, you got to schedule somebody to pick you up. And oh, by the way, did you collect all your belongings? And oh, by the way, did you do this? And on top of all that fatiguing information, we're going to just lay on what we think is relatively simple information, because we've, studied that condition for like a large portion of our lives. But we're going to try and give them a cursory understanding of their condition on their way out the door. I can see in that context, it's, looking on its face, it's a horrible idea. There's no guarantee they'll understand any of that.
Right. And what I love about the teachback method is that it's so simple, doesn't cost you any money. It's relatively easy to pick up.
Right.
All the teachback method is essentially making that patient report back to you in their words what you recommended them. It gives you a lot of insight into the patient's mind too, kind of where their head is at. You're able to fill in any gaps. And you get to learn how they communicate as well, which can help you even on future visits.
So a lot of times we talk about hurt versus harm language, and I think number one, the term teachback is a fantastic way to say it, because I'm going to ask you, Rebecca, can you just teach me back what I told you? Instead of saying, Rebecca, can you tell me exactly what I just told you? Right? One of those is kind of like threatening, and the other one is a open-ended, let me teach you about this. And it's almost empowering to that person to tell us what they learned. I know you had a great story about when you were, I think, at the VA, about how language can really affect the psyche.
Yeah, it makes a lot of sense. Our words can hurt people, our words can help people, whether it's healthcare related or not. And it's something that needs to be at the forefront of our minds. And in today's world, everyone's kind of excited or scared, or they have really intense emotions related to medical diagnoses.
Right.
And what I saw the most at the VA was the concept of degenerative disc disease. We had very, very young patients who were getting medically discharged from the military. And when they came back, if they still had some ongoing issues, they would get imaging done. And providers would just blanketly say, like, oh, you're 34. Oh, your MRI came back with some degenerative disc disease. And then it would just be kaput, done. No further direction on what that means, no further direction what you can do to work on that. And so patients would come into my office like, yeah, I've had, degenerative disc disease now for 5 years. I'm a lost cause. And so in the back of my head, I learned very quickly, you never know what that means until you look at the imaging. Because I had patients who thought that they needed a wheelchair for the rest of their lives. And then we pull up their MRI and they have mild disc narrowing at one disc in their low back.
Right.
And, these patients, bless their hearts, it's not their fault. It's just that they never appropriately learned. And the teachback method is a great way where if you are a provider, whether you're a PCP, ortho, chiro, neuro, and you are showing a patient what their MRI or X-ray shows, at the end of it, obviously describe it, but at the very end, you could report back and say, okay, Shelley, let's go ahead and talk about this now. Do you feel like you have a good understanding of what degenerative disc disease is?
Right.
What does that mean to you? And then just see what they say. It could be as simple as them saying, oh, it just means I have gray hair of the spine, but I can do XYZ thing. Or you might
Right.
get a patient that says, oh, it means I can't walk ever again. And then there's a red flag, like, let's talk about this some more.
Right. It's so powerful, and you can go down that path so many times. I think about all the words. One thing that they made a point of in the study is they say use, what is it? It's plain language, like the words you would use with a fifth grader or something. And there's another term that they use that I'm blanking on it, but it was like use plain language and caring language in a shame-free environment.
Right.
How many times do we use the term compliance? Like, oh, this patient is non-compliant. What do you mean by that? They missed a couple appointments, or they didn't do their homework. And if you were to say to that patient, well, Mr. Johnson, what's it going to take for you to be more compliant? That language doesn't make sense to that patient, and now creates a barrier between he as a patient, me as a provider, because it's not plain, it's not caring. My term of compliance is very different than what he says. Just like degeneration in the spine there's visual changes. That's all it is, right? Like, and some of it may be aggressive, but that's our job, is to interpret that instead of just lay that on somebody and then walk out of the room.
Right. And what I love too is that they talked a little bit about something called health literacy, which I had never really thought of until I read this
Yeah.
article. Just like there's general reading literacy, there's general, widespread education on certain things, there is such a thing as general health knowledge. And we're finding that, the article itself says about 35% of Americans had lower than an intermediate level of health literacy. And that makes total sense because in the grand scheme of
Right.
things, they don't really need to have more because we're supposed to be educating them well enough. And the reality is sometimes we're just not. Taking that extra mile is sometimes intimidating for providers. We think, oh,
Right.
I'm scheduled to have 30 patients today. I can only spend X number of minutes with each patient. But the reality is a lot of these things can take seconds to do and end up helping the
Yeah.
patient in dividends.
Wow. Yeah. Well, I think there is so much gold here in this article, all about the teachback method. And I'll tell you secretly, after reading this, I use it with my kids. All right, so teach me back what you're going to do today while I'm gone. It's like, I'm going to, vacuum, I'm going to clean the bathroom, and I'm going to feed the dog. Fantastic. Great job. High five. Right. And empowering them versus, hey, what did I tell you had to get done today? To feed the dog and this, and it changes the motivation. It changes a lot of things, but I love the term teaching. Any other details from here, Rebecca, you think are important?
No, I think this is just a huge takeaway to, again, just remind ourselves that at the end of the day, communication's what matters most.
Absolutely. And if you are looking to communicate with your patients more and get more referrals, get more reviews, and provide just a better learning experience, right? By communicating in the way that they communicate, which is probably through two-way text message, then check out trustdrivencare.com, where we have the tools to do it. It's a patient relationship communication software where you can help communicate clearly in between these visits and when people are coming in for their visits, so that we don't have these huge barriers to communication, and it really provides a better experience for the patients. Well, thanks so much, Rebecca. It's always a pleasure.
Yep. Thanks for having me.